Hi there. So today we're going to talk about inflamed acne and how to calm it down. So we're going to address what inflamed acne is, what causes all this inflammation, why should we calm it down before we attack the acne, and we're going to talk about how to reduce that inflammation and calm the skin down. So if you've got inflamed acne, this video is for you. My name is Oda Mukhele and I love teaching ladies how to achieve a clear skin through good nutrition and a great skincare regimen. So, inflamed acne occurs much more deeper in your skin compared to regular pimples or regular acne. So the person who has inflamed acne might feel, might experience like swelling, there's pain involved, the pimples or the pustules are inflamed, they are angry, they're red, it has nodules, they have cysts on their skin sometimes, and it's quite painful. So to explain what causes all this inflammation, we have to first look at how a pimple is formed. That's going to explain what causes all this inflammation. So if you think about our skin, we have pores on our skin, right? And each pore has got hair follicles in it. Now, attached to the hair follicles is a sebaceous gland or an oil gland. Now, this oil gland's job is to nourish that hair follicle. It's also, the oil comes out into your skin. It's there to nourish the skin and moisturize your skin. Also in that hair follicle or in that pore, we have bacteria that lives there. It's supposed to be there. It contributes to the healthy microbiome of our skin. But in particular, we've got the P. acnes bacteria, and that's the one responsible for acne. Now, the bacteria also lives off of the oil produced by the sebaceous gland. Now, typically in a person who's got acne, their skin tends to be a bit more oily. So the sebaceous gland is overactive, it gets very excited, it produces a lot of oil. Now, what happens is as the oil reaches the surface of the skin, it mixes with your dead skin cells and it makes the dead skin cells sticky and they form a plug and they close off the opening of that pore. Now, what happens is oxygen can't go into the pore anymore, and it causes an anaerobic environment inside that pore. Now, the bacteria that lives there loves an anaerobic environment. It thrives in that environment. So it starts reproducing, it eats more of the oil, the numbers grow, it's happy. But now, as the bacteria is feeding off this oil and reproducing, it produces waste material, and an excess of this waste material actually irritates the lining of your pore, and this causes inflammation. Now, the second there's irritation or inflammation, our immune system is triggered. Once our immune system is triggered, white blood cells rush to the area and they start fighting that bacterial infection. And this is how inflammation is created. So basically, the deeper the infection, the bigger the infection, the more the inflammation you see in that skin. And that's because of your immune response. And also, if you think about a pimple, if you've got those like white heads or pustules, the white stuff you actually see on top is your white blood cells fighting the bacterial infection. Typically in adults, you might find that they have inflamed acne, but the skin is not oily. That happens a lot for most adults. Now, what causes that is stress, your hormones, basically mainly your stress hormones make the sebum produced by the sebaceous glands, the oil, it makes those sebaceous glands produce a sticky, thick oil. And that is what basically contributes to the whole infection. Not that your skin is oily, it's just the oil you are making is sticky and it's thick. The reason why we have to calm down the inflammation before we treat the acne is, if you think about it, if your skin is inflamed, you are in pain, it means that your barrier doesn't function properly anymore. Now, on our skin, we have a protective barrier called called the acid mantle. Its job is to make sure that there's moisture kept inside our skin, prevents moisture from leaving our skin, also protects our skin from any irritants entering our skin. Now, for your skin to be healthy, that barrier needs to function properly. The ingredients used to treat acne, we've got your alpha hydroxy acids, beta hydroxy acids. We do resurfacing or exfoliation. We use retinol sometimes to treat acne. And if you actually put those ingredients on a barrier that is impaired, they will actually go into your skin very quickly because there's no barrier. They will go into your skin very quickly, causing more irritation. So what you will feel is a lot of tingling. You're going to feel a lot of irritation. It's going to contribute to the inflammation, and we do not want that. The more inflammation you have, the more scarring you're going to have in the end. So you want to calm that skin down before you introduce active ingredients to the skin. Your skin won't be able to tolerate the active ingredients. That's why we have to calm that skin down before we start treating the acne. Now, how do we approach the skin? We're going to have to keep our skincare routine very simple. A gentle cleanser, a hydrating moisturizer, and a barrier cream. And that's all you do. No active ingredients, no exfoliation, nothing. You leave the skin alone. The barrier cream will also help replenish and restore your barrier. Now, once your skin has calmed down, then we can start actually adding your active ingredients and we can start exfoliating again. But even with this process, you gotta add the active ingredients slowly into your skin. If you add them too quickly, you might have adverse reactions. In conclusion, treating acne is actually a marathon, not a sprint. You take your time with it, you do not rush the process. I know that acne can be very unsightly, but patience goes a long way in preventing scarring. What also can increase inflammation in your acne is stress and your diet. So manage your stress levels and eat a healthy diet to make sure that inside your body there's little inflammation. The less inflammation you have in your body, the less inflammation you're going to have in your skin. I hope you guys learned something from today's video. Please don't forget to subscribe, and I will see you next week. Bye.